The pandemic did what we could not do for almost 20 years. In healthcare, for a very long time, there was very slow adoption of technology because we do not have value-based care in the healthcare system in India. I've been a very huge proponent and advocate of what is happening in the Ayushman Bharat digital mission. I strongly believe the introduction of a longitudinal record with the ABBA ID is the way to go. So what hasn't changed is the nature of healthcare being very human-centric.
Hi, I'm very happy to welcome Bharat Gera. You have seen over the last 3 decades use of technology. You are one of the first pioneers who did what is now known as digital health or telemedicine. So tell me, how over the last 3 decades you have seen the evolution, changes in digital health and use of technology in the healthcare sector. Bharat, welcome to this conversation.
Thank you, Ganesh. Good to see you again after many times.
Wherein you had done what is perhaps now called as telemedicine. You had people from US using video in the workout hospital looking at patients. So over the last 25 years to 30 years, how have you seen this entire use of technology in healthcare, especially hospitals, evolve? Obviously, at that time, there was no internet, there was no smartphones, there were no mobile cameras, but you have seen the entire journey. Would love to hear from you the way you have seen this.
I'll begin with that story of how people reacted during the pandemic. I will switch to a more recent time and then go back to the past. The pandemic did what we could not do for almost 20 years. So when you say 25 years back, we did some early work in digital health, what is today called digital health or telemedicine. It didn't move that much forward for almost 20 years.
But adoption was not there?
Yeah.
Acceptance was not there?
Yeah. So even though technology in other industries grew and accelerated over the years rapidly, in healthcare, for a very long time, there was very slow adoption of technology. Somehow, the pandemic changed the picture completely because this whole thing was taken away, the physical part of healthcare delivery.
Because there was no choice, people were forced.
Absolutely. So during that period, people realized all across the board, including patients, doctors, everybody involved, realized that there's so much that can be done with technology. And that realization led to a flood of people entering digital health technology, which has really accelerated the process in the last 4 or 5 years since the pandemic. But one thing that I keep saying in my sessions on human centricity is that because change happens, but some things never change. So what hasn't changed is the nature of healthcare being very human-centric. And how problems can be solved in healthcare cannot be solved only by technology alone. They have to be solved with the human touch. And that's what even in the last 5 years when the acceleration has happened, after that we've seen a complete failure of digital health technologies. After even huge investments were made into them post-pandemic, we've seen the valuations go down terribly.
Because the human element was not taken care of?
I think replacing the human element completely with technology never worked. Whether you take telemedicine, where I work with some of the startups working with rural health, if you have a healthcare worker working along with a remote doctor, the success rate is much higher in terms of being able to do the diagnosis, be able to get the patients to adopt it. Bringing in that required level of human element is very important in making technology work.
So almost like a hybrid model you're saying rather than a pure digital model,
Absolutely.
Which perhaps is possible in a fintech or a edtech.
Absolutely. So what people are calling digital high-touch model is where healthcare works with technology.
Since you touched upon it, what was the reason for this lagging, slow adoption in healthcare of technology as compared to say banking or payments or even education, where I think we saw a fast adoption over the last 2 decades of technology?
I think one big reason that everybody understands is regulation. Healthcare is very regulated sector. So because of the regulation and the cost of failure being very high, it's a life and death situation. False diagnosis can be extremely negative. You give the wrong drug to the wrong person, that can be extremely bad outcomes, right? The regulators don't allow technology to move as fast as it can actually move as it's moved in other sectors.
Are you seeing some changes with, say, limited experience or sandbox or some kind of controlled experiment to bridge this gap between the need for disruptive innovation and need for regulation, rightly so, like you said. Are there examples, and how are they doing it?
I definitely think there's a lot of improvement in this area and encouragement by the government. I would like to point out the schemes from BIRAC and DST, which help the innovative healthcare delivery platforms do a lot of groundbreaking technology and science work, which is required for innovation in healthcare. On consumer side, on consumer-centric part of the healthcare innovation, again, the COVID led to this relaxation of regulations, specifically on telemedicine. The Telemedicine Regulation Act came in, the reimbursement for telemedicine came in other countries. A lot of incentivization has changed and regulations have been relaxed to allow innovation to happen in the recent years.
How much of this digital and use of technology can help or is helping and going forward will help in solving this problem? I mean, making it more efficient for hospitals to operate, making it more convenient for the patient with the app, all of that is great. But will this really make a breakthrough disruption in accessing the vexatious problems of Indian healthcare?
Definitely. I think access to healthcare with newer technologies, telemedicine is no longer only about video consultation. There are point-of-care diagnostic devices, point-of-care tests which can be performed for diagnosis of the patient and then consultation on tele-platforms. That is definitely having an impact. It's not scaling as well as people expected it to, largely due to monetary considerations, which are the incentivization of all the players is not done in the way that these outcomes can be scaled, because we do not have value-based care in the healthcare system in India. We have fee-based, service-based economy model.
Government's role, things like Ayushman Bharat, ABDM. What do you see as the adoption and future of this? How effective are these as initiatives? Obviously, it's still early days, but would love to have your thoughts on it.
I've been a very huge proponent and advocate of what is happening in the Ayushman Bharat Digital Mission. I strongly believe the introduction of a longitudinal record with the ABHA ID is the way to go, and a person-controlled healthcare is unique in the world the way it has been conceived in the ABDM, where the person is in charge of giving consent for their access to the data of their health. The reason for it being a little problematic right now in terms of adoption is largely because there's no incentive again in the economic system for people to adopt, especially the private players to adopt Ayushman Bharat.
Is it because the rates are very low, or with scale the rate should?
So there are two parts of it. One is the adoption of the digital platform.
Okay.
And the other is the adoption of the insurance schemes that are offered by Ayushman Bharat. There's such a huge variability of the pricing in this market that you can get from 25,000 to 2.5 lakhs, right? But what is the right legitimate cost that the scheme should offer? And that can only be done when population health is studied with the data that is available.
Thank you. Very nice speaking to you.